Welcome to another episode of Dr. Doctor, the award-winning radio show and podcast featuring your physician host, Dr. Tom McGovern.
And I'm Dr. Chris Stroud. And on this show, with our guests, we'll discuss relevant health-related topics, and we'll do it from an authentically Catholic perspective.
And today, we have a new guest to Dr. Doctor, who will be heard across the EWTN Global Catholic Radio Network. His name is Dr. Larry Mitnaul. Larry is a child psychiatrist in Wichita who I met at Focus on the Family. He's a member of their Physician Resource Council, and he's a child psychiatrist who's going to help us to better understand anxiety in kids.
You know, it's amazing that this is even a topic, isn't it? When I first started preparing for this episode, you think, what could there be that would make children suffer from anxiety? Trying to decide what sport to play, to decide which house in the cul-de-sac to visit for lunch today. You know, it's a shame in many ways that this specialty even exists. And yet it does, doesn't it?
Pediatric psychiatry is busy. I've learned it's hard to find one, especially a good one, somebody who, views the world the way we do as Catholics.
Not easy. That's not easy in a lot of specialties, but particularly in counseling and psychiatric care, very, very difficult.
And anxiety is the most common mental health problem in adults, about 20% of adults. And in children, it can be up to 30% by the time kids hit adolescence. So even at age 5, 1 in 7 children meets criteria for anxiety. It's incredible.
You know, one of the things I look forward to asking our guest is this pediatric anxiety an example of affluenza? Is this a first world problem? Have we moved beyond worrying about food on the table so that now we can worry about other non-life-threatening things? I think that's a way oversimplification, but it will be interesting to hear him address that, I think.
And we've done several episodes. If our listeners haven't heard Dr. Kevin Majors, a Harvard psychiatrist, talk about anxiety, they've been very enlightening. And one of the things he pointed out is that everyone experiences anxiety. We can't control the fact that it happens, but we can control what we do for it or do with it. And the problem typically comes from engaging it with worry, dread, or rumination. That's where the suffering comes from. And I had a chance to talk to Larry back in October about this. We went for a nice walk around Focus on the Family's campus on a beautiful day. And he's got some wonderful ways of looking at things that were very fresh, even for me.
Well, this idea that anxiety is an emotion that we can't necessarily control, but we can control, as we'll learn, maybe what our response to that emotion is.
Like in Monsters Incorporated, Chris?
Yes, the same thing.
Well, I understand one of your favorite movies.
One of my favorite all-time movies. Yeah, that's the point of that is that, we've all been afraid of monsters under the bed or monsters in the closet, especially. Or, my 11-year-old won't go to the basement because it's dark. That's not what we're talking about when we talk about pediatric and adolescent anxiety.
Yes. So we also will explore how has the pandemic affected anxiety in children. I can't imagine that's been a good thing.
Yeah. I mean, of course, as we said, worries and fears are natural. We're not talking about that. And certainly the pandemic has brought on a new layer of complexity to all of the normal and complex human emotions. But we're talking about the case when anxiety and fear become persistent and excessive, causing notable distress or impairment in day-to-day life, not just usual or typical fears. These are limiting the child or the young adult's ability to function as they ordinarily would function. And the disorders are most common. They are the most common of the adult psychiatric disorders that begin in childhood. So of the adult psychiatric problems, some of them begin in childhood. Childhood anxiety is the most common of those which begin in young children. And they're associated with, not surprisingly, underachievement in school, with co-occurring and other psychiatric problems, with functional impairment that can extend well into adulthood. But probably, I think, most important and most tragic for us to remember is that these disorders have the ability to steal the very essence and the beauty of childhood from a child. So stop and think about that for a moment. And now suddenly it seems much more important than monsters under the bed, doesn't it?
Yes. I have seen kids who suffer from this, and your heart just goes out to them because the problems are, it's a problem of thinking, of an unhealthy way of thinking. And thankfully, Larry has some practical tips to give about how parents can help their children to get out of that type of straitjacket way of looking at the world.
Now, if our listeners, Tom, know anything, they know that we in medicine love language. And so we like to keep things neatly organized. So the DSM-5, which is really the diagnosis manual that helps mental health professionals make diagnoses, it includes 7 anxiety disorders in children, and they are as follows. Number 1 is generalized anxiety disorder. We often call that GAD. The other is social anxiety disorder. Number 3 is panic disorder. 4 is agoraphobia. That sounds like it should be in the trivia question sometime. Number 5 is specific phobias. I'm afraid of cats. I'm afraid of ladders. Separation anxiety disorder. And lastly, selective mutism.
Wow, where you just don't talk because you get so fearful.
So anxious. And I think we're going to hear from our guest in the development of these disorders. It's really not well understood, and that they can be determined by a complex set of interactions, like so many things between biological factors, psychological factors, and laid on top of that, social and environmental factors. And of interest to our listeners, I'm also sure, is that parenting styles appear to be a critical environmental component to anxiety disorders.
I can't wait to learn how to be better parents, especially for our kids with anxiety.
So with that as a backdrop, Tom, let's move forward with what I know our listeners are waiting to hear, this episode's medical trivia question of the day.
And here we go. We're going to go to a 2011 book called How Plato and Pythagoras Can Save Your Life by a psychologist, Dr. Nicholas Kardaras, where he explains the benefits of treating depression and anxiety with an ancient Greek approach. What's new is old, what's old is new. And he calls it the Pythagorean way of life. Don't worry, I'm not going to quiz you about the Pythagorean theorem. That's that whole a squared plus b squared equals c squared thing. No math question. So, the successful Pythagorean approach to reducing depression and anxiety included 4 components. Included number 1, a vegetarian diet. Number 2, vigorous physical exercise. And then the trivia question deals with the other 2 of the 4 parts of the old Greek way of treating anxiety and depression. It included 1, philosophical discussions. But what was the topic of the philosophical discussions? And number 2, living life in a specific way. And what was that way? So we'll find out about the philosophical topic and the way to live life, according to the Greeks, that would help anxiety, after the interview with Dr. Larry Mitnaul. But hang on, we have Dr. Larry coming up here after the break on Dr. Doctor, coming to you from the virtual studios of Redeemer Radio. Welcome to our special guest interview today with Dr. Larry Mitnaul. He's going to talk about anxiety in kids. And Larry was raised in a military family, traveled a lot, got a bachelor's in biology at University of Dallas, managed a pediatric oncology research lab, then got a master's in biomedical science policy and advocacy. Then he managed a diabetes lab. Then he went to the University of Texas Health Science Center, where he got both a medical degree and a master's of public health degree. Sounds like the forever student here. Then he did an adult psychiatry residency, followed by child and adolescent psychiatry fellowship at Dartmouth, way up in the upper right-hand corner of the country in New Hampshire. He's board certified in psychiatry, as well as child and adolescent psychiatry. He now lives, of course, in Wichita, Kansas. Who'd have thought? He has a wife and 5 children, devotes time to advocacy, teaching, public speaking, and percussion instruments. And he's most readily found these days on his YouTube channel, Larry Mitnaul. Welcome to Dr. Doctor.
It's a pleasure to be on. Thank you for having me.
Well, Larry, thanks once again for coming on as a guest and making Tom and I feel professionally inadequate and underachieved, if there is such a thing. But thank you very much for coming on. So we were talking a little before you joined us about pediatrics and trying to decide what would a child ever have to be anxious about. But I think a lot of times we think about pediatrics as just little people medicine, little people, little doses of the same medicines that big people need. So what are some of the fundamental differences in the approach to children versus adults as patients?
Sure. I think there are a couple things that stand out to me that make the practice of child psychiatry just a little bit different in seeing these young ones. Probably one of the most notable is the number of informants it takes to help come up with a plan and to figure out what's going on with kids. I think, all of medicine, requires some degree of kind of detective work and following the clues, and often extends beyond kind of the primary story that that the patient can give. And so I think, while a lot of my, colleagues have, maybe blood work and physical signs and imaging to use, which I do use at times, in kids too, it's a little bit different in that, I'm encountering the child, but then also working a lot with the family, often getting, maybe some additional testing or hearing from the school too. And so often I get to hear the voice of a child and the child's kind of community together, letting me know what it is that they're seeing. Also in seeing kids, all of those, early thinkers that people, mention here and there, like Piaget and Erikson and Mahler. I mean, we use those developmental frames a lot. And so there's, on one level, we're looking for kind of a diagnostic, checklist, but we're also trying to, use a framework of thinking, what is this child's developmental level? What can we actually expect them to experience? What are some of the emotions or their coping strategies that are just a part of, who they are right now at this age, versus some real pathology that can cause them some issues or trouble down the line.
So Larry,
yeah.
as we record this episode, we're seeing the COVID virus numbers really make a tough comeback, and none of the trends are looking good. What mental health problems in children have you seen affected by the pandemic?
Sure. I think, certainly the length of social isolation. I think the literature that's still kind of growing and that we're looking at is still probably one of our strongest predictors of some of the future mental illness things that kids might be suffering with. And so that really plays a large role. As I was talking about, part of assessing a child is knowing how they're doing in their community. And so when they lack that community, they really lack a lot of the resources and some of the sustaining, pillars that really help them to be as successful as they can be. And so it's probably no surprise that we see, and certainly I've been seeing, an uptick of kids in my practice who are struggling with, loneliness and feeling of isolation and disconnection, and a little more anxiety than they typically would.
Now, we certainly see that in adults. Do you think the isolation and the lockdown sort of mentality of the pandemic, do you think children are uniquely at risk for that, or do you think it's equal compared to adults?
I think it's been interesting to see. I think the most recent kind of meta-analysis I looked at, actually kids might have been doing a little bit better than parents when it comes to being able to, be victorious over the anxiety and some of the stressful, situations that they're facing. However, parental stress for a child who's been affected by COVID or been hospitalized by COVID is actually quite a bit greater, both on the dimensions of depression and anxiety for their kids who are struggling. And so, and why that's important is, kids who struggle with anxiety, it's not uncommon that, genetically their forebears have had some degree of anxiety too that they've struggled with. And so if a parent is struggling, often that is a vulnerability for the child as well. And so I think that's having an impact as well, even if kind of indirectly, it certainly is on their environment.
Larry, what's a useful, practical definition of anxiety for our listeners to use?
Sure. I think, the definition I like is anxiety is our internal warning system that's aimed at, or its goal is to detect and avoid danger or pain. I think those are kind of the the two big constructs. We use a diagnostic and statistical, manual. We're currently on our 5th edition that was released in 2013. It kind of separates out fear and anxiety. So it kind of puts fear in the box of kind of an emotional response to some type of imminent threat. So you can imagine, like, being face to face with the saber-toothed tiger. Okay, that's a fear response. There's a very clear thing that we can kind of see ahead of a child, and it kind of parses out anxiety as kind of anticipation of a future threat. So maybe something that actually isn't happening in the here and now, but they're thinking about that test. They're thinking about the challenge ahead.
And everybody has anxiety. This is normal, part of being a human being.
It is. It's part of the human experience and how we're wired, really.
So how does it become a problem?
Okay, so that's a really good question. So, I think there are a couple things to consider. One is that I think we're all come into the world built with just different temperament styles. And so I actually recently wrote an article for Focus on the Family that talks about just different wiring and temperament that we come into the world with. And I think there are some kids who just, their expectation or appreciation of what could be dangerous or what could happen around the corner is just a little bit higher than the average. And so that individual, thought or anticipation that something anxious could be around the corner of itself isn't necessarily a negative, but really it's the reaction to how one responds to it. And it can be reinforced by how one's, environment kind of responds to a stress. So I think in the article, I used the example of Winnie the Pooh, because I think most people, young and old, have probably, seen that before. And so Piglet really is the archetype of, kind of the bundle of anxiety. And so with kids in the office, sometimes I'll draw an example of, you can imagine Piglet being in his bed, waking up early, and it's still dark outside. And he's so anxious that, his mind thinks there could be something dangerous lurking in the room. And so what might he do? He might pull out his flashlight. He might, turn the lamp on and off. He might call out, "Pooh, are you there?" He might do, 10,000 different gyrations to finally feel confident enough to stand up in the morning. And so your brain can draw a couple of conclusions from that. So one conclusion is, I've done these, 10,000 things, and that's made my environment safe. Or actually, this is one more day where I've gotten up in the morning and there's nothing to be anxious about. Okay. So the difference, how someone takes those experiences, lumps them together and forms a conclusion for it, I think helps set them up to either, continue to experience that worry in the pit of their stomach versus feeling like, actually, the data is, I've awoken, 2,374 mornings and everything has been absolutely fine.
So Larry, give our listeners, a real world example of maybe a pre-adolescent child with anxiety. Beyond Piglet, what does that actually look like? In an actual child, what does that actually look like?
Sure. So imagine, if you would, an 8-year-old who every time they're getting ready for school, just before the family's about to leave for the day, maybe they have their lunchbox, they have their backpack, but suddenly there's always seems to be a tummy ache or some rumblings there, or maybe a little bit of headache. And so the length of time it should take, the 10 paces from, the mudroom or from the kitchen to the car, instead becomes, maybe a 15 or 20 minute ordeal where there's, maybe some bribery, coercion, tickling, I don't know, but to get them there. And so, you can imagine kind of a kid who just, maybe the same 8-year-old who's also having trouble initiating his day and getting in the van might also, occasionally ask parents about the finances of the home, even though the child has experienced, no periods of material lack significantly, or poverty, or prolonged, absence of the things that they really need. And so again, the child might be saying things like, well, my stomach hurts all the time, or just asking for a lot of, reassurances. Is everything okay? I'm looking forward to getting a job next weekend. So those are that might be, the tone of a young kid who might be struggling with anxiety.
And how does anxiety look different at different ages, from preschool on to older adolescence?
Yeah, that's a really good question. I think, it depends. So when we talk about anxiety, usually it's kind of an umbrella term that refers to a lot of different flavors of anxiety. But for teenagers, as you get older and they get a little bit more self-reflective, it tends to be more outward. So you might see a little bit more kind of social anxiety, performance-related anxiety in an older kid, whereas in younger kids, you might see a little bit more separation anxiety. So, you're going somewhere and they have difficulty, separating. Maybe going to school is part of the separation anxiety. Maybe being in the grocery store and parent asks them to grab a box of cereal and come back to the aisle. So that level, they could be really overwrought with emotion around that, but you don't expect to see that perhaps in a teenager. The anxious teenager might say, Mom or Dad, I feel really anxious, or might not even use the term anxious, might talk about some physical somatic symptoms, and you might see them shadowing. That's the term we'll sometimes use, where maybe they're covered in a blanket, and your usually gregarious, independent child seems to be huddled next to you everywhere you go. You're trying to work in the office, they want to do their Zoom classes in your office. You move to the kitchen, they suddenly get hungry for a snack too. And you're wondering, what's going on here? Why are we having difficulty separating? So that might be some of the differences.
Huh. And since we're a Catholic show, something
Yes.
that, I don't know if it's uniquely Catholic, but does the concept of scrupulosity fit in here?
It certainly does. I think that's one of the features that I probably see more in religious families when it comes to especially obsessive and compulsive types of anxiety, where someone ruminates and just can't be free of overthinking, a situation or a scenario. And so sometimes I'll see kids who are struggling with just, sin. Maybe they have committed an act and they've availed themselves of the sacrament of confession, but they just can't seem to feel the peace and the grace from the sacrament. And so they might still continue to ruminate, perseverate on it, and often with the help of their priest and maybe a professional, helping them to gain some reassurance that nope, it was done, validly, and you're free to kind of move on. But they might be tied in an unhelpful way to a preoccupation with, what have I done wrong, or feeling stained, or feeling like they have to continually, repeat an act over and over.
How does puberty affect anxiety? Is this an extra added stressor that adults don't have to worry about who have anxiety?
Is this gas on the fire? That's
yes, yes.
Essentially, for each child, it can be, it can certainly be different. So I don't want parents or other professionals who, just because they've seen some social anxiety or separation anxiety, expecting that things will necessarily get worse. However, puberty does tend to enhance certain features, and can, for a lot of people who struggle with anxiety, enhance some of the features of their anxiety. And so, and sometimes actually that might be the onset of symptoms is around 13, 14 years old. So for instance, we tend to see the social anxiety piece is actually the median age of onset is about 13 years old. So 75% of kids, it's, between the ages of 8 and 15. So we know that once you activate the HPA axis and the cortisol is going up a little bit and driving things, that these kids do tend to struggle a little bit more. And so parents may say, well, maybe they've had a little bit of anxiety, but it's never really been this functionally impairing. It hasn't made their world smaller. It hasn't stopped them from pursuing things that they're interested in, from performances, from social relationships. And so that might be a sign that maybe this was percolating all along, but development has kind of pushed things to a stronger presentation.
Larry, the last thing we'd want to do is for our listeners to maybe blame themselves if they have a child suffering with anxiety. But we talked a little bit at the beginning that parental styles and maybe family cultural styles could play a role in someone who's maybe prone to anxiety. Help our listeners understand what that might look like, and what what might be done about that?
Sure. So in younger kids, what a common theme and that I might see is, a parent who is, I think, well-intentioned in attempting to allay a child's fears, and trying to comfort, but they might do it in such a way that they actually remove the child ever having to face the anxiety. So, rather than thinking about, okay, every time, you have to go to the basement, maybe we never let Johnny do it. We always delegate it to, big sister, big brother. And so he never gets the opportunity to kind of grow through the challenge. Now, maybe there are things that we do. Another way to, for a parent to attack it might be, okay, maybe we put up some extra lights. Maybe we go down accompanied a couple of times until they've built up the confidence to be able to do so independently. So one is, I think as parents are noticing maybe some differences, noticing that their child might be struggling in some way, looking for ways to support them while also challenging together, which can be a fine, balance to thread. And so in that regard, it can be helpful to have, a therapist or some book resources too that help them to kind of suss that out. The other thing too is that, if a parent also knows that they are struggling with anxiety, actually it may not be one of the better interventions too may be if they get some help around learning how to cope better and model that for their kids, they may in turn become the best coach actually for their younger kid. And so there are children who have seen me and actually have left my office without a recommendation for, necessarily individual therapy for the child or for a medication, but the family is going to do some work together and see if that in turn helps them to move the dial and to improve.
Larry, what are some triggers that should say to a parent, I need to help address my child's problem with anxiety?
Sure. I think probably the biggest ones for me are when they notice their child's world becoming smaller. And by that, I mean, the interests that the child really enjoys and thrives in doing, they're no longer able to participate. So for instance, say, I'm going to pick the most socially available distance sport that a kid could be in right now, which is probably fencing, right? It's both masked and if someone gets within 6 feet, you get to stab them. Right. So say a child is engaged in, in fencing, but every time it's time to go to fencing practice, they come up with a million excuses and your child. So you've kind of run the gauntlet of, it's not this, it's not that, it's not something medical. It's not, it's not something else that can easily kind of explain this, then that's probably anxiety. And so I think when parents see meaningful things in their child's life fall away, so again, avoidance of family time and social interaction, avoidance of meal times together, avoidance of attending school if in school is an option, avoidance of mass, avoidance of these things. I think when you see that when it starts to feel like the child's world is smaller and smaller and smaller, due to some of the struggles that they're having, then those are the times to seek help.
Well, Larry, with that, I think we'll take a break. I can't wait to hear a lot of the other topics that we're going to cover. We'll be back after the break with our special guest on childhood and adolescent psychiatry, right here on Dr. Doctor.
Abortion,
pornography,
embryonic stem cell research,
corporate contributions to Planned Parenthood. Do you invest in companies that are engaged in these practices? The Ave Maria mutual funds do not, and their investment portfolios reflect that. Ave Maria mutual funds are managed to conform to pro-life and pro-family values. Long-term investors can invest in the no-load Ave Maria mutual funds. You can learn more about the Ave Maria mutual funds today at 866 Ave Maria or visit AveMariaFunds.com.
And welcome back to Dr. Doctor from the virtual studios of Redeemer Radio. So Larry, just after the break here, what are some of the ways that children try to cope with anxiety, even if no adult has taught them how to do it, and maybe they're trying to do it under the radar so their parents won't notice?
Sure. I think, younger kids are perhaps a little less stealthy with being able to hide the anxiety that they're feeling. And so the good news is younger kids who tend to struggle with it, You'll see you might see crying or tantrums. Some kids you'll just see get frozen, frozen in their place with fear. And the other thing too that's really, really common with young kids is clinginess. So just the inability to kind of, separate and wanting to be around you. And again, that would be in excess of the normal snuggles, cuddles, that a family might typically do. I think as you move a little bit older, that in terms of the fight or flight response kind of gone awry. So one might be in terms of the flight side. So seeing kids be really avoidant of activities that either they previously enjoyed or just an inability to kind of strike out and try new things. The other is rather than the tantrums and crying, you might notice just kind of an argumentativeness or a bite or kind of a caustic attitude that kind of keeps you at bay a little bit. That might cause you to ask what else is going on for them and why are they struggling and where is this coming from? The other thing too for both young and old kids too, you might see them engage in ritual, and not the healthy kind of ritual that we like to have families establish, like meal times and prayer times and things like that. But where you find that things are ordered towards actually making people more bound than making them more free. And so that's the bedtime ritual that began with one kiss on each cheek, which is now 14 kisses on each cheek with 2 teddy bears and a Eskimo kiss. So looking for the rituals that really don't really serve the purpose of bringing kind of the family closer together, and instead seem like a delay or hesitation from moving on.
And where does social media play into bad coping mechanisms?
Yeah, that's a really great question. And unfortunately, I think the onset of device use and it seems to be trending kind of earlier and earlier. And so in terms of talking about avoidance, I can't think of better avoidance from dealing with a real world practical stressor than to pull out the digital library you have in your pocket that's connected to all kinds of really wonderful content that allows you to escape, but not kind of feel or sense or face down maybe some of the anxiety or discomfort that someone is feeling. And so I think to use that analogy that I mentioned before about a child's world becoming smaller, so often it becomes so small that you can almost picture a child hunched over their device, curled into a ball, because that's where all of their time, their energy, their kind of resources going to. So often that is one of the things that we're talking about, whatever the treatment plan is, and helping a child to feel more free, is to untether them from media consumption, passive media consumption all the time.
What kind of professional should parents seek when what they're doing at home doesn't seem to be enough? What tips can you give for a Catholic parent to find a Catholic-friendly counselor or psychiatrist?
Sure. I think the first is word of mouth, obviously, between the physician, especially if they know them and also kind of share their values. And so you might have friends or colleagues also that know of great kind of Catholic providers or Christian providers who have that same ethic. I think there can be some helpful questions in the kind of interviewing process too, when connecting your child to therapy. So one is recognizing or asking the question, what is the format of the therapy or the appointments like? So will the child be there doing an hour a week, for 8 to 12 session without any parental input? Will the parent be, a part or apprised of what's going on during the appointments, where there'll be time set aside? And I'm not saying that the parent has to be there, for each, full hour of time. But I think ultimately, in terms of helping kids to feel more free, we also want to strengthen the ties and kind of connection to family. And I think often the Catholic and faith-based practitioners see the preservation of the family and making sure that the work that they do integrates the family rather than separates them or tries to individuate them in an unhealthy way. So I think asking questions about what's the manner of the therapy, how what's the typical lay out, and how much parental involvement is a part of the treatment planning.
So if they say that they do cognitive behavioral therapy or acceptance and commitment therapy, would these be good things, bad things, neutral things?
Those are really good things. Those are probably the most evidence-based kind of interventions that we have for kids. And the good thing is they really focus their problem-centered modalities for helping kids and helping adults even to end their struggle with anxiety, or to at least to reduce it. And I like those. I like those types, and I think people who are really faithful to the model, parents can generally be assured that that the work going on behind the closed door is going to be in service of helping their child with anxiety and not venture off the field to other things.
And what's the role of medication in treating anxiety in kids?
Sure. So medication in kids, my philosophy, and I think the gold standard for child psychiatry, is that really we try to use it as a last resort. That the goal is, if we can build that resilience and coping strategies, that's kind of our primary way to get in and help kids to feel free. I'll remind parents that really there's no skill in a pill, and so that's ultimately we want them to have the skills that enable them to be successful in life. And so I think of the medication kind of like a cast. So if I find that kids have been engaged in really good therapy, but for some reason they're just not progressing, they're just not able to get over the hump, even though they've been doing really good work, often medication tied to the therapeutic work actually can really lower the threshold. So maybe their anxiety was a 10, now it's a 7. Well, 7's a functional level and gives the child a little bit more chance of having success at mastering, incorporating, and practicing the techniques that they're learning.
So just like a cast comes off of a limb with a healed bone, so the medicine can come off when they've learned those skills.
That's absolutely right. So the medication is kind of holding things together while the body is healing itself over time. And that's one of the great things about treating anxiety disorders in kids, is that we're not anticipating forever and ever, amen, especially when it comes to medication. The goal is to help them to get to a place of functionality, and then we look for a window to be able to pull it back to allow them to thrive.
Larry, we've had guests from all sorts of specialties talking about all sorts of ailments that at the end of it all, it seemed like it pointed to food as poison. And when it comes to childhood and adolescent anxiety, is there a role for diet and nutrition that can play a role to make that better, worse, or is there no role for that?
Yes, I am someone who I think we have some good evidence to suggest that kids who are well nourished, that's actually healthy for their bodies and young developing brains. And so actually I will tell families that in terms of diet, I take the food that you eat as the first medication that you're actually giving your child. So if we can get them eating in a more healthy way, helping them to live an overall kind of healthier lifestyle. And that doesn't mean you can't ever have, Cheetos, but it shouldn't be the primary, it can't be a substitute for kind of a well-balanced diet. So I think food is great. I think hangry isn't in the DSM-5, but it is a real phenomenon. I've witnessed it.
Any of us with children have, yes.
Yes. Yes.
And that made me think of parents with children with anxiety often feel overwhelmed. What can they do to help with their own frustration, burnout, whatever they're experiencing? Because these kids are often quite taxing on them emotionally.
They are, and so one is for parents not to blame themselves for feeling that way. So I come in, parents see me with a lot of parental guilt for all the many things they wish they had done already, and so actually that's okay. In psychiatry training, the reason you're given a mentor along the way too is that not only to kind of process your own feelings, but to allow you to recognize over time that your feelings are actually a cue, that they're telling you something. So you don't have to be mired by the feeling, but the feeling is letting you know, hey, why am I feeling so exhausted? It's because likely there's a technique, there's something going on here that's recurring that's draining my tank, and it's not helping my child to be successful. So I think one, if a parent can take stock of, I'm feeling overwhelmed, how am I approaching it? Is there something that I can be doing differently? Am I getting wound up in an anxiety spiral? And so we're pushing each other, up in terms of levels of anxiety, rather than either one of us being able to help each other bringing it down.
So what can that mom or dad do in the moment when they're feeling that way and they recognize it?
So I really like sensory things. So I think before a parent kind of goes with their gut or their first response, drink something with 10 ice cubes in it. I mean, do something that kind of shocks your senses. I actually had a parent once who said they had calming water, and when I asked what that is, it really just had carbonation. So it didn't have to have flavors or anything, but just something sensory that helped them to kind of calm down before they found their response. And so I think sometimes we feel pressured to have the right answer in the moment for our child's meltdown or frustration. And often, even if a licensed therapist was standing next to you, none of us might have the right answer in the moment. So taking that time for yourself, giving yourself a little bit of peace and perhaps a moment of prayer, and then returning to the situation.
But does that physical thing bring them into the present moment and out of their head?
Yes. Yeah. So it's something what happens is, I think it often kind of distracts from the thing that seems like the primary thing. So part of anxiety, the root of the anxiety often is, for the child. So from the child's perspective, I missed this homework problem. I'm getting a bad grade in this class. I'll never graduate. And then I'm going to be hopeless and poor and die. Right. I mean, the end of the anxiety is always, and then I'm dead at the end. And so often something that helps you be grounded back to reality, that's a different sensation, can be just enough of a window to give you space to take a step back. Because if you're in that cycle with them, descending to the levels with Dante, it can be really hard to find that peace and to bring your child out of it. So I think if a parent can find their peace first, and finding maybe something sensory that gives them a break or forces them to take a break, then re-engaging, they might find that half of the time what they return to is actually already started to simmer down or head in the right direction, and now we can start doing something productive.
So diet, I assume, means low amounts of sugary foods, sugared pop, maybe even diet pop, fatty, a lot of fat. So, but what's the role then for exercise?
Yes. So exercise actually is really important, and I think it's one of those understated things that kids can be engaging in that can help them, and actually it helps adults as well. I mean, I talk a lot about kids. I think the studies have been pretty strong that kids who are getting 30 to 60 minutes of moderate to vigorous cardiovascular activity in a week, that tends to help lower some of their autonomic arousal responses too, and help them to better kind of manage their anxiety. For adults, it's I mean, at least the last studies that I looked at look to be a little bit higher, so closer to maybe 75 to 150 minutes 2 or 3 times a week can be really helpful for that too. And that's especially important too, both because of social isolation and maybe the limits that kids may be getting physical activity at school. But then also, for us who have to contend with daylight savings and less time outside, and things getting colder too, that can be one of the things that we overlook. But exercise actually is really important and healthy, kind of coping too for kids.
Larry, do you see a difference between male, female in this response? Tom and I are both homeschoolers of both boys and girls. And one thing we learned early on in our homeschooling was sometimes you had to have the boys just go run. Whereas the girls didn't always have to do that. So with that in mind, does anxiety, does it look differently? And does the response change by gender?
It does tend to in large groups, and I say that, and of course there are going to be girls who respond to
Sure.
taking a good run, or playing tennis, or whatever their stress reliever might be. But it does turn out that we do see that boys getting engaged in some kinetic activity tends to be really helpful. So much so that actually I have I know that I have kids in my clinic who we've significantly delayed the onset of medication just because they were able to do a season of a sport, that during the football season, during the basketball season, being physically engaged, that was tremendously beneficial for their mood and for their anxiety. For girls, actually, we tend to see for most anxiety disorders, maybe a little bit higher level when you compare the sexes. And interestingly, in a recent meta-analysis, it looked like in terms of social isolation, girls are maybe struggling a little bit more. And I think that also may, I think, we also tend to see girls at younger ages being more attuned to kind of the social awareness and that level of connection. Again, not that boys don't need strong, emotional connections too. But those are some of the ways that I often see it being a bit different between, both the teenage girls and teenage boys that I see in my practice, that the girls might not need to run it off as much. They might need to talk it out, with friends, with, family, and have that type of connection to help them.
Larry, in our last couple minutes here, what practical resources can you recommend for parents to use with their kids before they see a counselor or a psychiatrist? And what's like one thing that they could do if they see their children in the moment struggling with anxiety?
Sure. So maybe I'll start with the resources. So there are some really good workbooks out there that I often recommend for families. One is called Coping Cat, and it's for younger kids, and it basically takes cognitive behavioral therapy and really kind of makes it very accessible for kids. The other thing is, I think it can also be helpful for families to do some of the work modules together. And so I think often I've heard from families that the parent is benefiting from learning and teaching the skills or going through them with their young kids.
So Coping Cat, like a feline four-legged animal.
That's right. Yes. Coping Cat. The other is, there is a really great series called by a psychologist whose name is escaping me at the moment. The titles are, what to do when you dread your bed, what to do when you're overwhelmed by worry. And there's a series of these that actually kind of that really do a good job of both describing the emotion, because I think kids often have a very limited, emotional vocabulary to describe the feelings that they're feeling, and then also giving them things to work on. And those workbooks are actually good for kids of, throughout the spectrum and kind of age ranges. And then in terms of a pearl for parents, I think one is calling the feeling a name. And actually, this is something that I learned from that great philosopher, not quite psychiatrist, Mr. Rogers. There actually is a lot of power in helping kids to name feelings. And so, in the examples that I gave you earlier about the tummy aches and headaches, often kids use that because that's what they're feeling, and it's the closest word, the closest descriptor they have for what it is that they're feeling. And so often, helping them to develop the language and call it, worry or anxiety, and then normalizing it that everyone experiences it, can actually help them to feel empowered to take it on.
Larry, this has been full of practical wisdom and advice. Thank you for being with us for your first trip to Dr. Doctor.
Welcome back to Dr. Doctor from the virtual studios of Redeemer Radio. In the Pythagorean sort of way, Dr. Tom has the answer to the trivia question.
The ancient Greeks used to treat anxiety with a fourfold method. Number one, a vegetarian diet. Number two, vigorous physical exercise. And we've covered healthy diet and exercise with Larry. Two other things, philosophical discussions about what? About a person's purpose and meaning in life. Purpose and meaning in life in the universe, and then living a certain way. What way is that? and ethical way. In other words, the Greeks believed that right thinking about purpose and meaning and right acting ethically were essential to being free of anxiety. Isn't that something?
When you go off these tangents, it all sounds Greek to me. I don't know.
R. So, Chris, your top 3 takeaways.
Yeah, the TTTA, as you might say. I think one, it's simple, but it's true. Children have serious anxiety problems, and an alarming percentage of them, upwards of a third or more of children and adolescents, may have serious anxiety. So don't overlook it, parents. It may be serious. Second, be aware when a child's world seems to be getting smaller instead of larger. If they have anxiety and they're retracting into themselves and their world is shrinking, that may be a sign that things have really gotten serious. And then last, I really like this idea of medication as a cast, and that it's something that's used now to maybe bring the level of symptoms down so that the child can live and function and learn some other skills, some behavioral therapies to actually make them better and stronger in the long run. And just like a cast on a broken arm, it goes away after the arm heals. So parents, we don't have to be afraid if we think that maybe our child needs medication as a cast temporarily.
And as he pointed out, if the counselor practices cognitive behavioral therapy, acceptance and commitment therapy, if they are true to those therapies, really they are pretty much free of any religious components. It's just ways of thinking in a healthy way. So those would be a good thing in somebody that you're looking for, according to Larry Mitnaul and our previous guest, Kevin Majors. So thank you all for listening to another episode of Dr. Doctor, the award-winning official radio program and podcast of the Catholic Medical Association. We come to you from the virtual studios of Redeemer Radio on the EWTN Global Catholic Radio Network and invite you to share the good news of Dr. Doctor with a friend where they can listen on EWTN or their favorite podcast app.
And we'd also ask you to rate and review our show, help other listeners find us. Send us questions, tell us what you liked, maybe what you didn't like, what you'd like us to cover in the future. And be sure to tune in next week for your appointment with Dr. Doctor.
This is Dr. Tom McGovern.
And I'm Dr. Chris Stroud, and we're signing off until your next dose of Dr. Doctor.
Dr. Doctor is the official radio program of the Catholic Medical Association, whose members are dedicated to upholding the principles of the Catholic faith in the science and practice of medicine. The views expressed on Dr. Doctor do not necessarily represent those of your co-hosts or the Catholic Medical Association. Find our past episodes and keep up with the latest from Dr. Doctor by subscribing in your favorite podcast app and following us on Facebook. Get links to follow and subscribe or submit a question for our doctors by texting the word DOCTOR to the Holy Cross College text line at 260-436-9598 or visit redeemerradio.com/doctor.